Hi, my name is Christina with Zone Physical Therapy, and today we're going to be talking about bone stress injuries, part one. This is a three-part series where we're going to be discussing kind of what to expect after a bone stress injury. So this is part one. Think of this as a refocusing phase. So this is right after you have been diagnosed with a bone stress injury and what's kind of going to be going on here. So the harsh reality of this is, if you're in the middle of the season and you get diagnosed with this, your season's probably over, right? That's not always an easy pill to swallow, but if we rush back into this, you're more likely to have some reoccurring issues with this, and that's just not something we want. At this point, like I said, we are refocusing, and we need to be shifting your focus in this time period from now in this season to longevity and health further down the line. Maybe that's later in your running career, maybe your running career is almost over and we're looking at just other health issues that could be going on in the rest of your life. So it's not fun, but I used to always tell some of my athletes that after a bad race you get a 24-hour moping period, and then when you wake up in the morning, we need to wake up and have a plan. So it's completely normal to have some psychological and emotional connection with this, and need to take a little bit of time to process that your season's probably over and we're going to be putting things on hold for a little bit. But allow your time to have that time, but then we need to jump back in with a plan to make sure we're set for what's coming next for you and long term. So generally this is going to be like a couple months of non-impact exercise that you still can do. It's going to be a little bit different from case to case and severity and pain levels and just what's going on, but maybe you're able to cross-train if you're pain-free, but generally speaking, for a little bit of time, you're going to have more time on your hands. That doesn't mean you need to feel like we're slacking off or you need to stop thinking about running altogether during this period of time. We're just refocusing what we're looking at here and what we're working on. So the biggest refocus I want us to do is take a look at our nutrition. A lot of times I will refer to a registered dietitian, but for them to get a lot more in-depth idea of what's going on. But there is a large connection to nutrition deficits and bone stress injuries. And, we'll go further into this connection in some other videos later on. This is a pretty broad topic, but usually there's a correlation there. And it doesn't mean you're doing it on purpose. That doesn't mean, there's anything, it doesn't mean you're doing it on purpose, but somewhere along the line, oftentimes, our nutrition that's available is not meeting the stress we're putting on our body. And that's how we end up in this situation. Not always, but it's something that needs to be investigated. And so we can take this time to really get a solid foundation with our nutrition and get practice doing that, so that when we're ready to build back up, that's taken care of and that is looking a lot better. We're also going to work on some stress management. So stress management can have a really big role on the cortisol levels that your body is experiencing. So that can also play a role in how your body is healing and how bone's regenerating and just the general stress that your body is going to feel and how much training load it's going to be able to tolerate. And then when we're ready, at a certain point in time, we're going to be correcting some strength deficits. So depending on the severity of the bone stress injury, we may not be ready to attack this quite yet. But as time goes on, we're going to be able to throw some of this in there. So I would biggest one. This is a really good time to reassess your training plan. a lot of times as runners, we tend to think, don't fix what's not broken. My training plan's been working so long, so I don't really want to change anything up. But now you're here and you have a bone stress injury, right? So maybe we should have evaluated a little bit a while ago. So, but we can't change that. Let's check here. Let's go back and look at our plan. What have we been doing? What has it looked at the past week, month, year, years? And what can we do better, right? Did this play a role in where we're at right now? Maybe it did, maybe it didn't. But now's the time to sit down either with your training plan, if you're creating it yourself, or with a coach, or whatever group you're a part of, and look at were there any factors that could have influenced the stress that I've put on my body, and now I have this bone stress injury, right? So I highly recommend working with an experienced clinician with bone stress injuries. I cannot exercise your bone better. I can't do soft tissue to make your bone better. That's not how it works. But my job as a physical therapist is also to guide you in levels of activity that you're ready for, and to help promote better movement patterns that are going to take less stress on that bony area, right? And my job is also to help you work through some of those factors I talked about before, where we're refocusing. So a lot of it is going to be on you. We're going to make a plan, and you're going to go out and you're going to do it, and I'm going to give you guidelines. We're going to go out and do it. But checking in with an experienced clinician who knows what they're looking for each step of the way and can help you talk through some of these situations can be so valuable in giving you some sort of guidance when there's not really a whole lot of guidance on this topic. That's something we're going to talk about in the next couple of videos in this series. It's not take 3 months off and you're good to go. Start running full throttle. That's not how it works. So we'll talk more about it, but I would highly recommend getting linked up with an experienced clinician to help guide you through this process and make sure that you are safely hitting the mile markers and the benchmarks that you need to hit before we get to that point. Recently put out a blog, and we discussed a little bit about how, we've seen some studies that first 6 months you actually tend to have, or first 6 months after a bone stress fracture, sometimes we see decreased bone mineral density. So this is a really sensitive time for your body. And if we do too much too soon, we're gonna have a reoccurring problem, right? And that's not what we want. So the number one risk factor for a bone stress injury is a previous bone stress injury. So I don't want you to get in that injury, time off, injury, time off, injury, time off cycle. So I hope you stay tuned for the next couple of videos as we go a little bit deeper into that process. All right, have a great day.